Yeah, yes.
Because I mean, you're putting those stories out on LinkedIn. They're phenomenal as well. I've seen a lot of the feedback. It's great. But those letters, you have a way of capturing what's going on, connecting them to the mission in those letters, which I think a lot of people are struggling with. How do you keep them involved in? I mean, do you spend a lot of time on those, or is that just so easy for you? You just sit and write.
I try to find something that I feel strongly about. It makes it easier to flow when you feel strongly about it, and then kind of focus on those things. But I also want to see through their lens. Like, what are the analysts? What are the network guys? What are the engineers? What are they thinking about right now? What's concerning them? And then try to start from that point and kind of work backwards on it. There's a couple other people out there I think do a really good job of this. The CEO of Korn Ferry, I think, does an outstanding job of kind of connecting with his staff in kind of a similar fashion. And then I always try to bring in some story about my life to connect with my staff. And
it is the connection to the mission and the connection to you. We hear this all the time. People don't leave jobs because of, any number of reasons. They leave bad bosses.
Yeah.
And when they have a connection with you and they have a connection with that mission, we have the greatest mission. That's our biggest advantage, right? We work in a mission that everybody's a part of at some point.
One of the things we started doing within our ITS division meeting every other month is we have our CMIO present some sort of clinical scenario where IT played a key role in a clinical outcome. So most recently, it was a patient who came in with diabetic ketoacidosis. So it's a diabetic, they have super high blood sugars, and then they get super dehydrated, and it's a near-death experience when somebody's experiencing that. And the team had built out an amazing order set, and the order set was so detailed and so specific and so in line with best practice recommendations that frequently nowadays they turn these patients around so fast that when the hospitals come down to admit the patient, they're asking, why am I admitting? And so the last time the CMIO gave this example of this scenario, it was really all due to a great collaboration between the CMIO, the clinical staff, and then the Epic ACEP analyst who built this whole thing out. So I think those kind of things really connect us to why we're in business.